Welcome. This is the chapter on the diseases and conditions of the digestive system, and this is part 1. Impacted third molars. The third molar, or the wisdom tooth, is not positioned properly. It erupts at an abnormal angle. They don't have enough room to emerge or develop normally and can be painful. So you can see that's coming at that angle right there. Dental caries. This is an infection resulting in an erosion of the tooth surface. Okay, so let's go from 1 to 5. So 1 is the early stages. Acids dissolve the enamel in the crown of the tooth. And in number 2, moderate tooth decay. The dentine is attacked by acids and bacteria invade the cavity. In number 3, advanced tooth decay, you have the inflammation of the pulp. 4, you see necrosis of the pulp tissue, and in number 5, periapical abscess forms at the apex of the root. Okay. Periodontitis. This is an inflammation and infection of the ligaments and bones that support the teeth. Occurs when gingivitis is untreated or treatment is delayed. Infection and inflammation spread from the gingiva, to the gums, to the ligaments and bones that support the teeth. Loss of support causes the teeth to become loose and fall out. It's the primary cause of tooth loss in adults. Malocclusion, or poor bite. It's a misalignment between the maxillary and mandibular teeth. And you can see how these are the normal teeth, overly crowded. There's the overbite and an underbite. So I have a slight overbite, not quite that bad. Temporomandibular joint system, or TMJ. It's pain caused when the jaw joints and muscles controlling them don't work together. The TMJ connects the mandible, which is the lower jaw, to the temporal bone of the skull. Besides these two bones, the TMJ includes a complex of muscles, nerves, blood vessels, and cartilaginous discs. The muscles controlling the TMJ are predominantly the masticatory muscles, which muscles are used for chewing, but the neck, shoulder, and back muscles may have an effect on the TMJ. Possible causes are grinding teeth, holding the phone receiver between the shoulder and the ear, osteoarthritis, RA, dislocation of the TMJ disc, and whiplash as from an auto accident. Now, I actually have a very mild case of this, and I just kept getting jaw pain, especially on my right side, and it just wouldn't go away, and I didn't know what was going on. So I went to the doctor, and she ran all kind of tests, and she said, let me try one more thing. And then she grabbed my jaw, and she heard the click, and she said, oh, that's it. That's what you got. So I was grinding my teeth, and I didn't realize it. So when I made a conscious effort to stop that, the pain went away. It's not there anymore. All right, tooth abscesses. These are this is a pus-filled sac that develops in the tissue surrounding the base of the root of the tooth. Okay, there's a little pocket of pus. A mouth ulcer. This is a lesion on the mucous membrane. It's non-infectious, it's not contagious, and not sexually transmitted. Exposes the underlying sensitive tissue. There are two types, aphthous ulcer and a traumatic ulcer. Now the aphthous ulcer, caused by stress, food sensitivities, spicy or acidic foods, diet lacking in vitamin B12, folic acid or iron, Helicobacter pylori infection, a hormonal shift during menstruation. Okay. And the traumatic ulcer can be caused by biting yourself while talking or chewing, burning your mouth while eating or drinking something hot, misaligned teeth, or chewing on an electrical wire. Yeah, that'll do it. An aphthae, APHTHAE, is a small ulcer on a mucous membrane. These are also known as canker sores, and it's not the same thing as a cold sore. Now, a cold sore affects the skin and mucous membranes. It's caused by herpes simplex type 1. It lies dormant in nervous tissue with recurring lesions appearing throughout life. Thrush is a yeast infection of the mouth or throat. Candida albicans is the most common culprit. And that's a yeast, by the way, Candida. Oral leukoplakia. This is hyperkeratosis of the buccal mucosa, palate, or lower lip. Gastroesophageal reflux disease. It's also called GERD. What happens is you have return of the stomach's contents back up into the esophagus. Occurs when first of all, the lower esophageal sphincter is a ring of muscle located at the far end of the esophagus as it leads to the stomach. Occurs when the lower esophageal sphincter does not close properly and the stomach contents splash back or reflux into the esophagus. Stomach acid may change the cells of the esophagus. This change, called Barrett's esophagus, increases the likelihood of cancer from 1 in 100,000 to 1 in 100. Acid can get into the lungs where it can cause damage along with hoarseness, chronic dry cough, or asthma. Esophageal varices. These are dilated veins. Dilated submucosal veins develop in patients with portal hypertension, may result in upper GI bleeding. The portal vein is the major vein in the liver that receives its blood supply from the stomach, small intestine, pancreas, and the spleen. Portal hypertension occurs when there is an obstruction of blood flow through the liver and pressure rises within the portal vein. Now, these are longitudinal venous varices at the lower end of the esophagus as a result of portal hypertension. They are superficial and liable to ulceration and massive bleeding. Peptic ulcers. These are it's a hole in the gut lining the stomach, duodenum, or esophagus, mainly caused by Helicobacter pylori. Other major causes of ulcers are the chronic use of anti-inflammatory medications, NSAIDs, and cigarette smoking. A gastric ulcer is a peptic ulcer of the stomach. A duodenal ulcer is a peptic ulcer of the duodenum. And where do you think an esophageal ulcer is? That's right, peptic ulcer of the esophagus. Gastritis is an inflammation of the lining of the stomach. The etiology is common medications, alcohol, smoking tobacco, stress, or mechanical injury. The treatment is antibiotic therapy, antacids, antiemetics, bland diet, or eliminate the source of irritation. Acute appendicitis. It's inflammation of the veriform appendix due to an obstruction, and veriform means worm-shaped. Perforation is life-threatening because the infection then spreads to the peritoneal cavity, causing peritonitis, the most common and serious complication of appendicitis. The interior of the appendix is obstructed by a fecalith, stricture, foreign body, or viral infection. In many cases, ulceration of the mucosal lining of the appendix appears to be the causative factor. Whatever the etiology, bacteria multiply and invade the appendix wall, compromising circulation to the organ. You get necrosis, then gangrene, then perforation occurs. A hiatal hernia. This is a defect in the diaphragm that permits a segment of the stomach to slide into the thoracic cavity. Just below the diaphragm, the esophagus joins the stomach. In people with a hiatal hernia, the opening of the esophageal hiatus is larger than normal, and a portion of the upper stomach slips up or passes through the hiatus and into the chest. So there's your esophageal hiatus right there. Okay? All right. Now, these are some other abdominal hernias. This is a protrusion of an internal organ through an abnormal opening in the musculature of the abdominal wall. Typically, it's in a portion of the intestines. and it's categorized according to the location of the herniation. So an umbilical hernia is part of the small intestines pass through the abdominal wall through the navel. An inguinal hernia is the intestine or bladder protrudes through the abdominal wall or into the inguinal canal in the groin. 80% of those are male. Femoral hernia, the bladder or intestine enters the canal, carrying the femoral artery into the upper thigh, and this is mostly in females. An epigastric hernia, fat pushes through a weak part in the belly wall between the xiphoid process and the umbilicus, which the navel. Okay, and that it says that a weak part in the belly wall, that's the linea alba, and that's the median line on the anterior abdominal wall between the two rectus muscles, and that little white line that goes down the center. Crohn's disease. This is a chronic inflammation of the bowel. Affects all layers of the bowel. Causes are immune factors, allergies, genetics. The inflammation can cause holes and sores in the bowel walls because the inflammation also affects the outer intestinal walls. The loops, the loops of bowel may attach to each other. You have areas of inflamed tissue are often separated by areas of normal tissue. The sores and swollen areas may thicken and eventually block the intestine. Okay. Now, hold on. Okay, so the other picture we have is one of ulcerative colitis. This is a chronic inflammation of the colon with multiple ulcerations. The ulcers form where inflammation has killed the cells lining the colon. The ulcers bleed and produce pus. Ulcerative colitis often begins in the rectum and sigmoid colon and extends upward into the entire colon. Inflammation involves only the mucosal lining of the colon, which exhibits erythema and numerous hemorrhagic ulcerations. In addition, the affected portion of the colon is uniformly involved, with no patches of healthy mucosal tissue evident. Gastroenteritis. It's an inflammation of both the stomach and small intestines. It's also known as intestinal flu, traveler's diarrhea, or food poisoning. The etiology is infection, food poisoning, allergy, or lactose intolerance. It occurs in persons of all ages, and it's a major cause of death in developing countries. Intestinal obstruction. It can be a mechanical or functional blockage of the intestines. So you can have herniation, adhesions, intussusception. Intussusception is when the intestine, they call it telescoping on one another. So part of the intestine goes into the other part. And a volvulus is the twisting of the intestine upon itself. Diverticulosis, it's the presence of diverticula, which are small pouches, and they bulge outward through the colon. Okay? As a person ages, pressure within the colon causes bulging pockets of tissue. These are the diverticula that push out from the colon walls, found mostly near the end of the sigmoid colon. Now, if these diverticula become infected or inflamed, then it's diverticulitis, and that's an acute inflammatory disease. Pseudomembranous enterocolitis. This is an acute inflammatory disease of the colon. The causative agent is Clostridium difficile. It's often related to the use of broad-spectrum antibiotics such as clindamycin, tetracycline, fluoroquinolones, such as ciprofloxacin, levofloxacin, with the trade name Levaquin. This is also a nosocomial infection. The precipitating event for Clostridium difficile colitis is disruption of the normal colonic microflora. This is usually caused by the use of broad-spectrum antibiotics. A patient ingests heat-resistant spores, which convert to vegetative forms in the colon. Depending on the host factors, such as the immunoglobulin IgG response, an asymptomatic carrier state or clinical manifestations of C. difficile colitis develop. Short bowel syndrome. The small intestine is where the majority of the nutrients you eat are absorbed into your body during digestion. The small bowel fails to absorb nutrients because of inadequate absorptive surface. It occurs when portions of the small intestine have been surgically removed, or portions of the small intestine are missing or damaged, or both. Irritable bowel syndrome. It's also called spastic colon. This is a functional bowel disorder. It's associated with cramping, gas, abdominal pain, bloating, diarrhea, and constipation. There seems to be a neurologic component to IBS, and it is aggravated by stress. It is thought to be due to abnormal functioning of the walls of the large intestine. In IBS, the movement of the muscles of the large intestine is thought to be uncoordinated. Instead of contracting and relaxing in waves, they contract irregularly and lead to spasms. Peritonitis. This is an inflammation of the peritoneum. Short and simple. Hemorrhoids. They are dilated, tortuous veins in the mucous membrane of the anus or rectum, and tortuous just means they're like intertwined. These are varicose veins in the rectum. There are two types: the internal, which is above the pectinate line, okay, and the external below the pectinate line, and the pectinate line is the anorectal line. Okay, so these are the external and these are the internal. Okay,